A patient walks into my clinic after a couple of sittings, consultation, and investigations. I have drawn upon a treatment plan. My conundrum is how to present the same to the patient. सबसे बड़ी दुविधा ट्रीटमेंट प्लान को पेशेंट को कैसे प्रेजेंट किया जाए, especially if it is a big ticket or a medium ticket case. When we talk about the medium to big ticket case, it is usually 20 to 30,000 plus, usually in a normal tier 1 or tier 2 clinic, if I may say so. Now, what to do in such cases, how to present a treatment plan. The first thing you have to remember is that very, very rarely somebody will walk into your practice to get a big job done. They will always come through a referral, through your social media campaign, or through somebody, some loyal patient of yours who has referred the same to you. Now, how to present? I always encourage colleagues कि दो चीजें हमेशा पूछो पेशेंट से. Patient socioeconomic background and patient source of referral. PSEB and PSOR. So what will these two things tell you? The PSOR primarily will tell you the patient who has sent you the same. It doesn't mean you have to talk differently to different patients. You have to understand what exactly in the patient mind. And the second thing I said, PSEB, patient socioeconomic background. Now that is one thing which always tells you that the patient has not, the pockets has not been underestimated. Never underestimate the depth of the pocket of the patient. Now, people go on giving a treatment plan that suits their sensibilities. Sometimes there are cases which demand an out-of-box thinking, but we stick to the stereotype. Implant देना है तो implant ही देना है, bone है, ये है, age of the patient, economic background of the patient, other criteria not taken into account. Bridge देना है because I don't offer implants, so my options will start from bridge. I'm talking about a missing tooth. कास्ट पार्सल में करता नहीं हूँ, फ्लेक्सीडेंचर मेरी लैब अच्छी है नहीं यहाँ पे तो मैं ऑप्शन ही नहीं दूंगा. And so the certain option get missing. So I'm not going to go into the legal aspects, but the practice management aspects of the same, how to present a treatment plan to the patient. The first primary thing to understand, remember always, is identify the need of the patient. What exactly does the patient want? And this tells you that you have to listen to the patient. 2 ears, 1 mouth for a reason. Listen more, speak less. 2/3 by 1/3 is the ideal golden proportion. First, let the patient vent out what he or she wants. We sometimes suggest treatment plans based on our ethics, our specialization, or whatever comes to our mind that we feel is the best for the patient. In being best for the patient, you have to balance the patient's needs also. Sometimes you will say, it is a slightly longer span, I don't want to give a bridge. 2 missing teeth are sometimes counted as a longer span by the patients or by the dentists. So I'm not against that. I'm not trying to judge anyone here. I'm just trying to give out a simple formula for that. What exactly you have to do is you have to understand that the patient has come in to you for that situation of a couple of missing teeth, that the patient does not or is not able to eat properly. He does not want to stay like this. He does want to eat his meals happily so that he doesn't have a stomach issue, so that he doesn't have any other digestion issues. Get into the psyche of the patient. He is not interested in the money part. He is interested in who can provide me the solution to my problem. We look at a problem in a mechanical way. We have to look at in a emotional way as well. I'm not saying to ignore dentistry totally, but yes, keeping a balance between what is required mechanically and fulfilling the needs of the patient emotionally. That is what is the primary thing that is required. Identify the need of the patient. उसको क्या चाहिए? और बहुत सारे कलीग्स हमने ये किया, हमारे ये केसेस, वी, आई, मी, and you can say are the few people that I like. So I, me, and myself, I mean, so are the few people that I like. That should not be the situation in any one of us. We have to understand, listen more, speak less, understand the patient's need, and then give a diagnostic treatment plan which suits the patient's sensibilities. Patient's problem can be solved. Then we say, patient paise ke karan bhag gaya. We don't talk out to the patient. We don't spend time on the consultation. When we don't do these things, how can there be an emotional connect with the patient? And when there is no emotional connect, why would the patient choose you? Just because you are we, the people, or we, you can say whatever, we are doing this and that. No, the patient has far too many options in your area. We all know that. But it is not about the options first. It is about, you can say, people have money in their pockets. They're just looking for the right person who can solve their problem. So if you have these two things in your mind, identifying the need and the approach to solve the patient's problem, trust me, your treatment plan will never go wrong. And I'm saying that ethically also, in a mechanical way also, in an emotional way also. So if you like this video, please do subscribe to my channel. I'm Dr. Bhavdeep Ahuja. I'm completing 23 years of practice this year. And along with that, I've been teaching and coaching colleagues on the topics of practice management, medical legal aspects, and finance in dentistry. So please do subscribe to my channel and share the same with your colleagues. Thank you. Take care. Bye-bye.